Okay, that leads us to our group B streptococcus, Agalactiae. And this lives in the human vagina, the pharynx, and the large intestine. It's easily transferred to infants during delivery, and it can cause severe problems for them, including neonatal pneumonia, sepsis, and meningitis. So it's important to screen pregnant women and treat them for this. Also, wound and skin infections are caused by this, and endocarditis, especially if you have a compromised immune system. Now the group D and C and G groups, the group D is your Enterococcus faecalis. Um, this is going to be found in colonies in your large intestine, and it's an opportunistic bacteria that will infect your urinary system, wounds, and skin. And the group C and G, this is just common animal flora. But a lot of times you'll have upper respiratory problems from these, and pharyngitis, glomerulonephritis, and bacteremia. Now, to treat and prevent infections from A, B, and D streptococcal bacteria, we're going to treat it with penicillin. And if you have a history of rheumatic fever, or if you have recurring strep throat episodes, then you're going to have long-term penicillin prophylaxis. And that's how they're going to try to address this. Then you have your alpha hemolytic streptococci, and this is called the viridans group, and it's a very large complex group with Streptococcus mutans, Strep oralis, Strep salivarius, which we've worked with, Strep sanguis, Strep malari, and Strep mitis. These are most numerous and widespread residents of your gums and teeth, your mouth. They're also found in the nasopharynx, in your genital tract, and on your skin. They're not very invasive, but anytime you have a dental or a surgical procedure, that facilitates their entrance. You can get bacteremia, meningitis, abdominal infections, and tooth abscesses. The most serious infection is subacute endocarditis, where the blood-borne bacteria settle and grow on the heart lining or valves. And so if you have a pre-existing heart condition, you're at high risk. And they colonize on the heart and form these biofilms. The Streptococcus mutans will produce slime layers that adhere to the teeth. That's the basis for plaque. And of course that's involved in dental caries. So if you have a pre-existing heart condition, you need prophylactic antibiotics before any dental procedure. Streptococcus pneumoniae causes 60 to 70% of all bacteria pneumonias. The cells are small and lancelet shaped, and they're arranged in pairs and short chains. Cultures die in oxygen. They lack catalase and the peroxidases. Some of this is repeating from the previous slide, but all the pathogenic strains form large capsules. That's a virulence factor. And you have 90 different capsular types that have been identified, and it causes pneumonia and otitis media, getting into your ear and causing ear infections. As far as the epidemiology, 5 to 50% of people carry it as normal flora in their nasopharynx. And so the infections are usually endogenous. It's very delicate, and it won't survive long outside of its habitat. Pneumonia happens when the cells get aspirated into the lungs of people that are susceptible, like young children, immune-compromised, elderly people, people living in close quarters. And what happens is the pneumococci multiply and cause this overwhelming inflammatory response. And it can gain access to the middle ear by your eustachian tubes. To treat it, usually penicillin G or V is used, but it is showing increased drug resistance. There are 2 vaccines available for high-risk individuals. For older adults and high risk, there's the capsular antigen vaccine that's effective 5 years, and for children 2 to 23 months, there's conjugate vaccine. Bacterial pneumonia by Streptococcus pneumoniae is highly contagious. True or false?